So I'm so interested about the tongue. Like, so when people come in, how have you been able to diagnose anyone by seeing something on their tongue, or what have you seen or read about that I guess shows?
Sure. So this is very interesting. I encourage anyone and everyone to go to Google.
Yeah.
It's very weird. You can go down those rabbit holes of looking at
Like that's what
pictures.
I'm gonna be
Yeah,
doing that
you can
after this conversation.
you can do it. So, and again, I just want to reiterate that it's often a triangulation, meaning it's one input that then we use to go ahead and diagnose. But there are some pretty clear symptoms that we see on the tongue that then lead us to then further inquiry and
Hmm.
differentiation. In our medicine, we have certain rules of, staying within your lines and our jargon. And so we use words like dampness or our
Hmm.
chi or our blood. There are some pretty clear parallels with Western medicine. Say if somebody's really anemic in Western medicine, we would maybe notice blood deficiency signs on their tongue.
Oh,
However, they would need to go to their Western medical, primary care
right.
provider and take a blood test to confirm the diagnosis of anemia. But with that, we can guide them in directions and maybe catch something that maybe was not marked on
Right.
their physical exam the previous time. Candida shows up in the tongue a
Hmm.
lot, like a really thick, sticky coat. Sometimes I've seen like some infection. And, again, by further inquiry and based on what the patient's coming in presenting as, you're able to tease out maybe the root of where some
Hmm.
of their other symptoms are coming from. And then you would refer them out, say, to go to their dentist to get a checkup, see if they have an underlying infection. And if they do, you say, oh gosh, thank you for helping me.
Yeah.
And you feel really good about what you do because
Yeah.
the medicine itself has been around for thousands of years and
Hmm.
these patterns have been tested by observation and just, practice for many millennia. So ultimately, when we see it, we're confirmed with other tests. A person feels better. That's the gratification for us. And ultimately, they tell all their friends, and we keep getting people coming in, say, check my tongue, check my tongue.
Yeah. I love that. And I feel as though that's my mentality with my personal self of, yes, of course I'm going to listen to go to my primary doctor for things, but I love, like the cupping and acupuncture and learning about all of that stuff. I just saw on TikTok, there's a Chinese tea man in like Philadelphia that everyone goes to help like with their aliments. And I'm like, that's such a cool thing that people are able, like a gift that they're able to do. And I think that some people are, I don't know.
It all
I
works
love it.
together. It all
Yeah.
works together. And I think every doctor comes into medicine wanting to help their patients, and each doctor is specialized with a different
Hmm.
tool to help and for different main concerns. And I think any really awesome mechanic or any awesome like handyman out there will totally tell you you could get the job so done so much better with the right tools. And
Right.